So now, saving the proverbial best for last, now we're going to talk a little bit about ionic calcium therapy. And because of limitations in time and other things, I'm going to cover some highlights, and then I just encourage you to have a chat with the folks at Pernuvia. So first thing I want to say is just to bring it to your attention. I'm sure you've heard about this signal already, but there is an increasingly risky signal showing up in the observational literature related to calcium supplements. And there was a signal some time ago. We published some data related to calcium supplementation and increased coronary artery calcium volume in individuals across ethnic groups from the multi-ethnic study of atherosclerosis cohort. So there was a signal there that seemed to be vitamin D independent. But just recently, I think it was in Diabetes Care, there was a large observational study that demonstrated that calcium supplementation amongst individuals with type 2 diabetes increased risk of total mortality. And it was a significant risk. It wasn't a small risk. It was about a 70% increased risk in total mortality in those folks. And so, I think it's kind of time for a paradigm shift related there's popular books written about death by calcium, and there's been, some people who have pieced this physiology together from some time. But I do think as a routine practice, we should start straying away from calcium supplementation as a strategy for osteoporosis and osteopenia prevention. Because for one thing, the U.S. Preventative Task Force says the data is either insufficient or just very bad for the routine use of calcium supplements for the prevention of osteopenia and osteoporosis in community dwelling adults. There is some evidence once people have osteoporosis that maintaining adequate calcium intake is important. That probably stands to reason. You do have to have some coming in, or you're really not going to have any shot at laying down new bone, no matter how much you change the milieu. So that makes sense. But I think, measure people's calcium intake, right? Like look at their dietary calcium intake. Do a food frequency questionnaire, do a dietary review of somehow, send them to a dietitian if you're not up for spending the time to do that. There's a variety of questionnaires on dietary calcium intake. Like get an estimate of what their average calcium intake is just through their diet alone. And then be kind of cautious, because calcium shows up across all sorts of different supplements, right? There's the calcium supplement, but then there's the multivitamin, and then there's the sprinkle in that, joint formula. And then there's some in that formula that you're not really sure why they're taking it, but they're taking it anyway, right? And it's like it all kind of adds up. And next thing you know, you're in the excess of recommended, daily intake from supplements as well as diet. And that seems to be risky. I would go a step further and say that's especially risky in conditions like type 2 diabetes that are, sort of the walking model of chronic inflammation in every tissue of the body, and like protracted severe oxidative stress. And, you all know that calcification is the terminal result of chronic inflammation. And if ever there was a model of chronic inflammation, it's people with poorly controlled type 2 diabetes. And so, if you're pouring calcium into a calcifying structure, it's going to calcify, and that calcification is more likely to occur in the areas of direct calcification, including the coronary arteries and the kidneys and, valves and other tissues. So, just, something to be mindful of. So, ionic calcium therapy isn't calcium supplementation. So the products that are available, instead of looking at 500, 1,000, 1,500 milligrams, these products are 5 milligrams, 6 milligrams. Very, very, very small doses of calcium. And in terms of what it does in the body, these there's about like I said, 3 to 10 milligrams of calcium in the products, and they're taken in low doses multiple times through the day. And really the goal of these therapies, I would say, is to kind of biohack calcium regulation, but in a subtle way, in a way that doesn't increase ionic calcium concentration to the point that somebody goes into sudden cardiac arrest, but enough to be able to trigger a hormonal change such that the increase in ionic calcium concentration is enough to sort of switch the balance between parathyroid hormone continuing to mobilize bone more towards a sort of calcitonin dominant paradigm, where you're actually trying to shift it back towards bone formation. So that's pretty cool. And this is like structurally what we're talking about. So these products have a variety of calcium, ligands that the ionic calcium itself is non-ionically bound to. So this is the sort of terminology of anti-orbital calcium. So unlike calcium carbonate on the right here, where there's a clear covalent bond, this is really more of kind of a quantum level bond, if you will. It's sort of suspended in the structure, and the ionic function of calcium is sort of dissipated around the other anions, in this case oxygen anions that are present in the structure. So that's pretty wild. But what does that do? Well, that actually allows for the disassociation of ionic calcium from the carbonate part of the structure in an acidic environment, aka in the stomach, and direct absorption of ionic calcium through the wall of the stomach, so bypassing vitamin D regulation and other regulatory steps in the intestine and elsewhere. But remember, these are really, really low doses. So when I heard about that, I'm like, oh my God, these people are, in harm's way because of this. And I would say, like, don't drink a bottle of it, right? Because that is going to be very problematic. But the doses that are recommended, these are very low doses just to sort of spike the calcium concentration enough to change the hormones. So what do we know? What does it do? Well, one of the cool things and that I respect about the company is that they are continuing to invest in research. That's why I'm up here, because they invested in some research at NUNM and wanted to kind of help them, spread the word about the interesting science, but also I think spread the word around the importance of ionic calcium across multi-system disease. It really has expanded my awareness. But in terms of what we know, well, these are primarily, case reports. But looking at DEXA scans of individuals, this individual happened to be in the osteopenic range, and after 4 months of ionic orbital calcium therapy, now up into the normal range. There's kind of a similar case report here in the osteoporosis range, up at least into the safely into the osteoporotic range. Major change, and pretty severe osteoporosis at baseline there. So interesting case reports. This is a case series. There's a lot of individuals here that I'm not going to go in detail, but looking basically, blue is pre-AIC therapy, green is post-AIC therapy. You can see in most cases there's a significant change. In a lot of cases, you're taking these individuals were in the osteopenic or some cases severe osteoporotic range. And, I haven't actually calculated the percentage, but almost everyone has had, clinically meaningful improvement. These happen to all be men. Similar data in more women. You can look at the individual cases. We need to run some stats on all of these. We haven't done that yet. Now, this isn't everybody that's ever taken the therapy. I'm not going to lie and say this is every person who's ever done it, and we have follow-up data on all of them. No, that's not true. But this is a pretty substantial case series. These are a lot of individuals. Limited but still fascinating data. This is recent evidence in mice. Old mice specifically, I don't really know that much about old mice, but I know that old mice are prone to osteopenia and osteoporosis, and that's very hard to get that any better. And so this is an animal model of premature osteoporosis. This research was done here in the United States at the University of Arkansas. And we looked at the ionic calcium therapy was given by gavage to these animals. And then looking at bone mineral content change as well as bone mineral density change in both male and female animals. And not all of the findings were significant in men, and that's unclear as to why. It looks like there seems to be some short-term increases and then maybe a kind of regression to the mean here in men, both in bone mineral content as well as bone mineral density. But in women, there seem to be progressive increases and statistically significant changes in incremental increases in both bone mineral content and bone mineral density in these animals. And on average, this is about a 30 to 38% increase in bone. This happens to be bone mineral density status. Couple other radiographic findings. This is evidence of calcific tendinitis in a shoulder, sort of pre-post AIC therapy, where that calcification seems to disappear. This is after 16 months of therapy, so prolonged therapy. Similar calcific tendinitis here after that calcification is gone. One of the thoughts is that through increasing the calcitonin response and actually leading to more bone deposition, sort of hacking bone formation. Well, where does that calcium come from? Well, the observations suggest that that's mobilization of dystrophic calcification happening elsewhere in the body, because the signal in the bone is to form bone, so that calcium needs to be mobilized from somewhere else. So that's really interesting. I would actually really still love to see a study that looks at coronary artery calcium from ionic calcium therapy. That's a pretty risky study from an IRB perspective. We were planning to do some elements of that study at NUNM, and it didn't prove feasible for a variety of reasons, which is really disappointing. But I do think that we need to see that evidence. This is a cavitation post tooth extraction, where after AIC therapy, about 6 months of AIC therapy, there was increased bone deposition and some improvement in jawbone structure here. That's pretty interesting because of the common osteonecrosis that can happen with bisphosphonate therapy. So I don't think, it's actually really rare that happens, but when it does happen, it's quite severe. So I don't know if there are any case reports. You could talk with Pronuvia about people that are using AIC therapy in combination with bisphosphonate therapy. I suspect there have been people that have done that. The prevalence of our incidence really of that osteonecrosis of the bone from bisphosphonate therapy is extremely terrifying to patients to think about that risk, but it's really, really, really rare. It's like less than 0.05%. 1 in 1,000 maybe people ever have that. So bad news if it happens, but again, really rare. So that would be a hard study to do, but I think for if someone has it, then AIC I think would be a pretty interesting therapeutic to try, because there aren't a lot of great options for that. This is another example of looking at like post-extraction, new bone deposition after only 40 days of AIC therapy, so short term. There's some evidence of steroid-induced osteoporotic fracture, healing up, actually new bone deposition after pretty prolonged therapy, but still some improvement there. I guess actually it was only 2 months, so sorry, I couldn't read that quite right, but only 2 months of therapy there, some improvement there. This is more recent data, also from the University of Arkansas. This is a wound healing model, also in animals, so not related to bone, but mechanistically related to bone in a way that I'll get to. So this is a control treatment where they induce a wound and look at healing time. And then these individuals had ionic calcium therapy. I think it was injected close to the site, and actually seeing far more rapid wound closure. And you can see the re-epithelialization happening much more quickly, size of the wound, increased fibrosis around the wound, and likely reduced risk of infection. So what we were just chatting earlier about applications to burns and applications to diabetic ulcers and other things that are extremely hard to treat. So maybe some therapeutic potential there. And then actually looking mechanistically, you can see they stained the epidermis, and actually see this epidermal thickening in these AIC treated animals as the wounds are healing and closing, and then it seems to sort of normalize after time, which is also really fascinating, that you get this rapid increase and then normalization. And then they did some staining specifically of collagen type 1, which does have relevance to bone, because that's a predominant form of collagen that is in the microtubules of bone. And actually see increased collagen type 1 formation during the treatment with ionic calcium therapy. So pretty wild. And in conclusion, ionic calcium balance, critically important to normal cell replication, mitochondrial function, and health maintenance. Functions of calcitonin extend beyond the bone. I'm not going to go through every one of those again, but pretty wild, have implications for fertility, have implications perhaps for breast cancer tumorigenesis, implications for cognition. Similarly, osteocalcin, the take home there is that osteocalcin is sort of the direct connection between bone health, bone metabolism, and insulin resistance. And so especially in those individuals that may have co-occurring, the lesson is treat the insulin resistance at least concurrently with treating the bone, and then talk to the folks at Pronuvia about AIC therapy, because it'll kind of blow your mind. Thanks for your attention.